Hi everyone, welcome back to my channel. This is Dr. Ashwati. Today let's look at a review of non-accidental injuries. Non-accidental injuries are intentional injuries inflicted on children, usually by the caregiver or a family member. The mortality rate ranges from 0.1 to 8%. Therefore, prompt identification of non-accidental injuries helps in ensuring timely treatment for the child and prevent further injuries in future. While taking history in these cases, you will notice that the child is very young, usually less than 2 years of age, and the injuries are inconsistent with the history given by the caregiver or it changes over the time. Many a times, history is vague and unwitnessed. There is a delay in seeking medical advice. The caregiver may be unconcerned or aggressive with previous history of similar presentation. Risk factors associated with non accidental injuries are domestic abuse, mental health issues, and substance abuse in caregiver. Child parent interaction. When you observe the child, you will notice that the child has a lower responsiveness. He or she may be showing anger or withdrawal from the caregiver. Sometimes there is a dislike or a lack of interest. There are some physical examination findings that are related to non accidental injuries. So, when these findings are present, there is a high likelihood of abuse. When bruises are present in a child under 1 year of age, bruises of different age, bruises which are present at multiple sites, and when sites like eyelids, ear, frenulum, cheeks, angle of jaw, neck, or torso are involved, sometimes we can find the mode of injury with the help of the bruises. When bruises are present inside and behind pinna, it may be due to a blow to the face. Bruises present in ankle or wrist area may be due to ligature tied over the hands and legs. Almond shaped bruises may be due to finger marks, and ring of bruises may be due to bite marks either by an animal or a human. Some benign conditions like Mongolian spots and hemangioma may be mistaken for bruises due to non-accidental injuries. Unexplained bruises of different stages are present in ITP leukemia, so these condition has to be excluded before labeling the child as non-accidental injury. Fractures. When fractures are present in skull, especially occipital area, depressed fractures, fractures that cross the suture line, spiral fracture of the humerus, so rib fracture due to shaking, femoral fracture in a non-ambulatory child, metaphysis fracture in a child less than 2 years of age, torn epiphysis, and multiple fractures. If these are present, there is a high likelihood of abuse. Some conditions that can mimic fractures or multiple fractures are osteogenesis imperfecta and rickets. Intracranial injuries. When these are present in a child less than 3 years without an adequate explanation, when subdural hemorrhage is present in this child along with retinal hemorrhage, rib or long bone fracture, then we have to think in terms of non-accidental injury. There are some non-traumatic causes of intracranial bleed like glutaric aciduria, methylmalonic aciduria, vitamin K deficiency, hemophilia, von Willebrand's disease, Viscotaltid syndrome. These diagnoses has to be excluded before labeling the child as non-accidental injury. Burns, when present over both feet or buttocks, hands, may be due to immersion injuries. Small circular burns may be due to cigarette burns. And when hot objects are used to inflict injuries, we can either see the shape of the objects or a clear margin can be seen in these cases. Other examples of non-accidental injuries are perforated eardrums, retinal hemorrhage, spinal or visceral injury without major confirmed accidental injury, nail injuries, genital or anal injury due to sexual abuse, sexually transmitted disease in a child less than 13 years of age. Till now, we have talked about non accidental injuries. So, what are the characteristics of accidental injury? When the front of the body is involved, when bony prominence like knees, elbow, and forehead are involved, then we have to think in terms of accidental injuries rather than non accidental injuries. In neonates, subconjunctival hemorrhage and retinal hemorrhage are not doesn't come under the heading non accidental injuries. That's all, everyone. Thank you for watching my video.